Hi, I am Noelle LeBlanc, and I'm opposing A1978, which is the ban of tobacco products on college campuses. A1978 is an amendment to the already existing New Jersey Smoke-Free Air Act that passed in 2006, which prohibits smoking in indoor public places and workplaces. A1978 extends the act to include the prohibition of all tobacco products to the grounds of any public or private institution of higher education, in essence, college campuses. It was approved in 2014, so New Jersey has yet to fully implement the amendment on all campuses, but numerous colleges are 100% smoke-free in our state and around the country. This amendment is not necessary because smoking trends all across the country are decreasing and only a small proportion of students currently smoke. Because less and less people are smoking, the health of the college campus will not show dramatic improvements from this policy, as these improvements are happening naturally on their own. This graph shows the smoking trends from 1965 to 2011. In 65, the percentage of adults who smoked was 42%, and in 2011, the percentage was about 18%. Because less people are currently smoking, the policy will make less of an impact than if it were to be implemented decades ago when more people were smoking. Although it would not have been congruent with the social norms, banning tobacco products on college campuses in the 60s, 70s, or 80s would have been more effective in reducing the amount of lung cancer rates we see today. So these cancers and other illnesses that come from smoking and secondhand smoke would they take decades to develop, and since less people are already not smoking, in the future we will naturally be seeing lower rates of these illnesses. How effective can this policy be? Yes, signs and posters can be posted that inform the public of this policy, but they are not always followed. If a campus has a lax attitude on smoking, these signs will merely be a suggestion or completely ignored. And how can this policy be enforced 24/7? Constant surveillance would be needed to catch every violator, which means increased law enforcement, and depending on the size of the campus, that can be a lot, like Rutgers. A $250 fine for the first offense is a substantial amount to deter someone from smoking, but if enforcement is not uniform, there will continue to be violators. There are some colleges that have a student reporting system to report violations, but again, if there is a lax attitude about smoking, they will be less likely to report the violations. The stakeholders for this policy include the smoking community and the non-smoking community, the college campus implementing this policy, doctors and healthcare field, tobacco shops, and local law enforcement. So for the smoking community, they will feel discriminated against for having a nicotine addiction. We all know that addicts can't quit in an instant and that it is a medical illness that requires treatment. So it is unfair that they won't be able to smoke in well-ventilated outdoor places when they're already prohibited from smoking indoors due to the New Jersey Smoke-Free Air Act. Also, for the non-smoking community, in a well-ventilated outdoor space, the risk of getting an illness from secondhand smoke is almost non-existent. For the college campus, it is a huge project to implement a campus-wide tobacco ban, and depending on the size of the campus, it could be too large of a job to implement, especially if these smoking trends are already low. It might be seen as too much of a burden. Doctors and the healthcare field want to see a decrease in lung cancer and other diseases associated with smoking, but these diseases are now developing from all the smoking that took place in the past. So smoking rates are currently lower than before, so the future of cancer rates will be declining also. Tobacco shops surrounding the campus, and even those that provide tobacco products on campus, will be losing money. Without smokers, they will have zero business, and since there are already less smokers, they are already seeing a decrease. Local law enforcement will have to put in more hours for training and for ticketing the violators. While this could increase the amount of money being brought to the department, if the size of the campus makes it extremely difficult to monitor the grounds for violators, the policy would not be enforced 100%. So, in conclusion, the ban of all tobacco products on college campuses is not necessary, since we are already seeing substantial decreases in smoking rates, and having a smoke-free or tobacco-free environment is happening naturally. Why use the time and money to eliminate these habits that are exponentially decreasing on their own when we could be focused on rising problems that aren't getting the publicity and attention they deserve, like obesity and suicide prevention? Thank you.